I'm here in Chicago attending the 2019 ASCO meeting, and I was discussing yesterday at the CAR T cell session the part about future of CAR T cells, where we're going from here. So we were extremely happy to see the initial results with CAR T cell therapy for lymphoma. When patients respond, the response is durable, and that is very intriguing, very interesting. However, about 30% of patients don't respond, and 60% will relapse eventually. And so we are trying to modify the CAR T cell therapy and make it more up to date with what we know from the patients we have treated. For instance, we know that about 30% of the patients will not have the target antigen when the biopsy at relapse is repeated. So for instance, CD19 can be downregulated, it basically disappeared from the lymphoma. So the CAR T cells cannot recognize it anymore. So there are methods that are being explored now to circumvent that problem. For instance, using dual targeting, so CD19 together with CD22 or CD19 together with CD20. Other things that are being explored are more powerful CAR T cells. So the CAR construct is modified so that it can secrete, for instance, cytokines, which can preferentially expand a certain type of T cells, so cells that are more that have a higher killing activity or can persist longer once they are expanded. And then there are combinations that are being explored. So CAR T cells are being combined with anti-PD-1 or anti-PD-L1 antibodies. There are currently 3 clinical trials ongoing exploring this possibility. And we will see if it actually works. There are great results in mice, but unfortunately, what normally works in the experimental side of things doesn't always turn out to be the case in humans, but hopefully that will be the case.